Hey Abby, my name is Chase. I will be your nurse practitioner student conducting your head, ears, eyes, nose, and throat exam. Before I get the exam started, I would wash my hands, and before we start, do you consent to being filmed for this exam and having it posted to YouTube?
Sure do.
Okay, excellent. Thank you. And I know this is a perfect situation. Are you comfortable like this? Okay, sounds good. All right, first I will start out by examining your head. So I'm just going to first inspect your head. I'm looking for hair distribution to see that it's distributed evenly. I'm looking to see if I can visually see any lesions or hematomas or bruises or anything like that, which I don't see. Next, is it okay if I palpate your head?
Mm-hmm.
Okay, I'm palpating for any depressions, which I'm not feeling any. Again, any wounds or hematomas or anything like that, or anything that could be sticking out, which I'm not feeling. So excellent. Next, I'm going to check your eyes, your vision. And so this Snellen chart is supposed to be 6 feet away. So, but can you just cover your right eye for me, and then read the lowest that you can on this?
LTFPH.
Okay, excellent. And then cover your left eye for me and read that same line backwards.
HPFTL.
Okay, and then go ahead and both eyes read the lowest line there.
LTFPH.
Okay, excellent. So vision is at 20/20 on this Snellen chart. That's the best it goes on this chart for both eyes. So excellent vision there. Okay, next, I'm going to assess your peripheral vision. So, basically, I'm just going to have my fingers out here, and then just tell me, I guess you can kind of point to which side you see the fingers moving. So, so just tell me which side, okay? Okay. Excellent. Okay, perfect. Thank you for that.
Mm-hmm.
So the peripheral vision is intact. And next I am going to assess so your cranial nerves and your extraocular movements of your eyes. So basically you are just going to keep your head still, and then you're going to follow this pen light for me. So first I'm going to assess her cranial nerve 6, and so I'm going to do that by bringing this pen light out here. Okay, so cranial nerve 6 is intact. Next I'll assess cranial nerve 4. So I'll bring this down and kind of in. Okay, excellent. And next I'm going to assess cranial nerves 3. So there's multiple spots. So again, just continue to follow this and keep your head still. So I'm going to bring it out, up, down, to center, and up. All right, excellent. So your cranial nerves 4, 6, and 3 are intact. And while I was doing that, I was assessing for any nystagmus, which I didn't see any bouncing of the eyes. So next I'm going to check for your pupils being reactive to light. So first I'm going to check, you don't have to look at it, you can just look at me.
Okay.
So I'm going to see directly this right pupil was reactive to the light and it constricted. And then, so indirectly or consensually, her left eye constricted as well, and I'll do the same on this left eye. So directly it constricted, and then consensually the left eye constricted. So next I'm going to assess for convergence of your eyes. So just follow this pen light as I bring it closer to you. And just follow it, yeah, kind of in here. Excellent. So her eyes converged as I followed it in. And now I'm going to bring it close, and I'm going to, so focus here on the pen light, and then look to the wall, like focus on the wall now. Excellent. So I was checking accommodation there. So pupils constricted as she focused on the pen light, and they dilated as she focused on the wall. And by the way, the peripheral was it was called confrontation, the exam while checking for that. Okay. So next, I am going to take a look. Yeah, I'll actually use this for now. So I'm going to take a look at kind of some of the structures on your eye, and then I'll kind of look kind of towards into the back of your eye. So initially, I'm going to kind of use this. I guess I don't fully need it, but so I'm just looking at your eye. I'm looking at for any drooping, any bulging, which I'm not seeing. I'm also looking at the sclera, which is white, the iris, which is her natural color of brown, I'm assuming. Is that okay? Mm-hmm. And then I'm looking at the cornea, which is clear, non-cloudy, And then I'll take a look at the conjunctiva. I'm gonna touch your eyelid here, and it is pink. The lacrimal ducts appear patent. Eyelids are non-swollen, no redness, and nothing that appears to be blocking any drainage of the eyes here. So next, I'm going to take a look into your eye, and so what I want to do with her right eye, I'm going to hold the ophthalmoscope with my right hand, and I would use my left hand to kind of guide me, and then my fingers to prevent me from kind of hitting her with this. So I would also dim the light so I could see a little bit better. Okay, so yeah, you can just kind of look at the wall here, and I'm just going to find your red reflex. Okay, and come in. All right, and okay, I can see the optic disc. I followed the arteries and veins. Let's see, I'm just going to kind of move around. So optic disc is about a 0.3 0.3 disc to cup ratio. I didn't visualize any papilledema, no cognal spots, no hemorrhage, and no AV nicking that I could see. And the optic disc was clear, crisp, and it was small edges, or small with clear, crisp edges. And next I will do the same with your left eye. So I'll hold it again with my left hand. I'll find the red reflex and kind of come in. So, and I'm going to kind of put my hand here. So, we got the red reflex. Sorry. Okay, so I see the veins and arteries. I'm going to follow them to the optic disc. Okay, so again, optic disc, about 0.3 cup to disc ratio. Again, no AV nicking, no cognal spots, no papilledema that was visualized, and no hemorrhage that I could see from the veins or arteries of your eyes. So that's great. Next, I am going to check your. Let's start off with your smell. So basically, I have a couple oils, essential oils, and I'll just have you close one nostril, one there, and then just tell me what you can smell here. Obviously, not looking at what you're smelling.
Lavender.
Okay, excellent. So lavender, and then now close your other one.
Tea tree.
Tea tree, excellent. So by doing that, I know that her smell is intact, cranial nerve 1, and both nares are patent, and she's able to breathe through them. So next, I'm going to kind of assess your nose. So just on the outside, I'm not seeing any redness or drainage, and then I'll take a look up your nose here. Okay, so, sorry. Okay, so, no, that's okay. I was able to see. So, so no drainage present. I didn't notice any deviation of the septum, and no turbinates that I could see. No drainage, no redness. The mucosa appeared pink and intact. And then let me palpate. So I'm going to palpate your frontal sinus. Any pain there? Okay. And then maxillary. Any pain in that sinus? Okay. Any congestion or? Okay. Excellent. So now we can move on to your ears. So I'm going to switch this cap out. And then, so I'm going to do I'm going to check your hearing, cranial nerve 8. So I'm just going to cover one ear here, and then just tell me what you hear me saying.
Baseball.
Okay, excellent. And then
Tennis.
excellent. Okay, so hearing is intact. So next, I'm just going to look. I'm going to assess the outside of the ear for any redness, any discharge, any drainage, which I'm not seeing. And then I'm going to kind of palpate. I guess I can do it on this side so you can see. So I'm going to palpate. I'm going to pull back any pain as I do that. Okay, I'm going to palpate the tragus here, any pain. Okay, excellent. And on this side, no drainage, no redness. And I'm going to take a look into the ear. So I guess I will just sit here for this. So I want to kind of use my fingers to prevent me from going too far into the ear canal. And yeah, whoops, let me see here. Okay, so I will take a look. Gonna pull the ear up and back. And then again, I'm kind of using my fingers to guide me and not go too deep. Okay. So I'm looking at the optic disc. So optic disc is a pearly white gray, and I was able to visualize the umbo, the malleus, and there was no drainage, no bulging present that I could see, and the light reflex was at 5 o'clock. Oh, I meant the tympanic membrane. Anyways, so yeah, the tympanic membrane. Okay, and I will take a look here, doing the same thing. So, okay, so the tympanic membrane, again, is pearly white, like whitish gray, and then I was able to visualize the umbo, the malleus, and then no bulging, no redness, no signs of infection that I could see, and yes, I believe that's everything. Oh, and the light reflex was at 7 o'clock that I could see there. Okay. Oh, and next, let me do the tuning fork. So basically, I'm going to hit this tuning fork and place it on your forehead, and then just tell me which side you can like hear and feel it on. So I'm just going to hit it.
Both sides?
Okay, yeah. So it's on both sides. Checking for lateralization. We don't want to have it just on one side or the other. So it's good that you're able to hear it on both sides. That's the Weber test. Next, I will do the Rhine test. So I'm going to place this now behind your ear, and then so you should feel it and hear it, and then once you can no longer hear it, let me know, and we'll see if you can hear it, hear the vibration. So, oops, sorry, I kind of botched that. Okay, can you hear that?
Mm-hmm.
Tell me when you can't.
I can't.
Now?
No, yeah, that's cool.
Okay, so that is just testing that the air conduction is greater than the bone conduction, which that is normal. So that is what we want to see. Okay, and again we'll do it for your left ear. So tell me when you can't hear it.
I can't. No, it's cool. Yeah, I can hear it.
Okay. All right, so again, air conduction is greater than bone conduction. There. So next, I'm going to take a look here at your mouth and your lips and all of that fun stuff. So just taking a look at your lips, inspecting your lips. I'm not noticing any chapness, no dryness, no lesions are apparent. The lips are pink. And I will just have you kind of open your mouth a little bit. Yeah, I'm going to look under your tongue. salivary glands appear to be patent. I'm looking at the gums as well, so I'm going to pull down your, okay, gums, sorry, I'm going to look at your upper gums. Okay, so gums are pink, no redness, yeah, no redness, no apparent gingivitis, and then also let me take a look just at your teeth. Okay, teeth appear clean, and you can kind of open your mouth again, and no apparent caries. Going to take a look at the soft palate, and no deformities. Yeah, no redness. I'm taking a look at the tongue, the papillae, no inflammation, and no redness again. So now I'll have you stick your tongue out, kind of, yeah, perfect. So assessing cranial nerve 12 here, and then can you just tilt your head down a little bit? All right, and bring your tongue back in. There you go, yeah, give me an ah. Okay, looking at the uvula, also the tonsils. Okay, excellent. So that's assessing cranial nerves 9 and 10, as she says ah. I was able to visualize the uvula, which was at midline. The tonsils did not appear to have exudate or any redness or swelling, and they, I would say, were at a grade 2. And then the tongue as well was at midline. There was obvious tongue strength, which would be the cranial nerve 12. So now let me just check your swallow, which again this will test for cranial nerves 9 and 10. Just make sure that swallow is intact. You can take a big swallow. Excellent. That's great. Okay, so I think we got everything there. So now I'm going to check your some of your lymph nodes, and I'm just going to check to see if there's any lumps. So I'll kind of be palpating kind of throughout your jaw and your neck and your kind of the back of your head. So first I'll assess your preocular lymph nodes, not able to palpate, which is a good finding, and then your behind your ear here. Okay, again, not feeling anything. Your occipital lymph nodes, not palpating anything. Okay, and then now I am going to do your submental. Okay, yeah, not palpating. Submandibular, right here. Okay, nothing. And then anterior cervical. Okay, nothing there. Posterior cervical. Okay, not able to palpate anything, any lymph nodes. And then the clavicular lymph nodes, and nothing palpated there. Okay, supraclavicular, I believe. Okay, and nothing palpated there. And next, I will check your range of motion in your neck. So, could I have you just turn your head side to side for me? Okay, excellent. And then nod your head up and down, excellent. And then, yeah, kind of bend to both ears. Any pain when doing that? Any stiffness? Excellent. Okay, and then let me have you, so kind of push, so try to push this way against my hand. Like, turn your head, I mean. Sorry. Excellent. And then, excellent. Okay, so sternocleidomastoid intact as well. Okay, so lastly, I'm going to assess your thyroid. So just upon inspection, I'm not seeing any bulging or anything of that nature. So I guess I will have you kind of, if you can, kind of turn that way because I'm going to kind of come behind you. So, and sorry, can you come a little more towards the edge here? Thank you. Okay, and so I'm going to assess the thyroid, I'm going to find the thyroid cartilage, and then I'm going to find the cricoid cartilage, and then the top two rings of the trachea, and then this is the isthmus of the thyroid. And so I'm going to palpate here. I'm not feeling any bogginess, and it feels even to me. And then I'm going to have you swallow as I'm feeling that. Okay, it felt even with the swallow. And then let me just take a look here at your trachea. So trachea is at midline, and I'm going to kind of push against the trachea. And again, I'm not feeling any bogginess here in the thyroid. Then same thing on this side. Push against. Okay, excellent. Okay, I believe that concludes our exam. Hopefully I was able to get everything needed. I'm sure I missed a few things, but thank you for your help.
You're welcome. Are you talking to me?
Yep. And hopefully I press play.